Hello everyone, welcome back to MBBS Atlas. In today's video, we are going to talk about the triangles of neck. Of course, obviously, we all get confused in these triangles, the anterior triangle, the posterior triangle, their boundaries, their contents, and etc. things. So, let us try to understand these triangles in a small or a simple, easier manner. Okay, so in this particular video, I'll be talking about the posterior triangle only. So in the next upcoming videos we'll be taking up the concept of anterior triangles. In today's video we'll talk about the posterior triangle, their boundaries, their contents, and all of the concepts. So before entering into the video, I just want to give a small orientation to you guys about this posterior triangle. First, I'll be drawing up the bony landmarks. So think this as the mandible, this has the external acoustic meatus, mastoid process, and occiput, or the base of the skull. And see, we are looking at the lateral view, like lateral view of our face or head. So this is the hyoid bone. Okay, and here we have sternum. Along with it, we have clavicle, like this. Okay. Now we also have fascia like this. Now I'll be drawing all the muscles related to it. We have a muscle called as sternocleidomastoid. So this sternocleidomastoid is originated from the two heads, like it has two heads, right? One sternum head, one clavicular head. It is originated like this and inserted onto the mastoid process like this. Sternocleidomastoid, name suggests sternum, clavicle, and mastoid process. And we have another muscle called as trapezius. It is originated from the clavicle and it is inserted onto the base of the skull. So this is the trapezius muscle, like this. Okay, and we have a muscle called as omohyoid, and it has two bellies. This attachment of omohyoid is from the hyoid bone, like this. It is originated like this and it is inserted like this. So it has two bellies. So this is the superior belly of omohyoid and this is the inferior belly of omohyoid. I'll just name them in detail so that you guys don't get confused. So this is the trapezius muscle, right? This is the trapezius muscle, and this is the sternocleidomastoid. This is the superior belly of omohyoid, this is the inferior belly of omohyoid. I'll just write the names roughly. So this is trapezius, this is inferior belly of omohyoid, this is superior belly of omohyoid, and this is sternocleidomastoid. Okay, now I think you guys can appreciate a triangle here like this. This is only the posterior triangle. Now I think you guys can easily tell the boundaries of the posterior triangle. So this is the anterior side and this is the posterior side, right? So what is the anterior boundary of the posterior triangle? The sternocleidomastoid. Posteriorly we have the trapezius, base is formed by the clavicle, and apex is the meeting point of these two muscles. Okay, now these boundaries are clear and you can clearly appreciate that this triangle, you can see that this posterior triangle is again divided into two triangles. So this is the one triangle and this is one triangle. It is divided by which muscle? It is an MCQ. The posterior triangle is divided into two triangles. It is divided into two triangles by which muscle? By the inferior belly of omohyoid, right? Yes. Now what is this triangle named? We have discussed that the inferior belly divides the posterior triangle into two parts. So this, the upper triangle, it is called as the occipital triangle. Occipital triangle. Whereas this triangle, the smaller one, it is called as the supraclavicular triangle. Supraclavicular triangle, or it is also known as the subclavian triangle. Okay, I hope you guys are clear. So this is about the small orientation of the posterior triangle. Now I think you guys can clearly appreciate the boundaries of the occipital triangle as well as the boundaries of the supraclavicular triangle. Again, the boundaries of the posterior triangle also. Okay, I hope you guys are clear. If you have any doubts, please do comment in the comment section. Now we'll go in details of this posterior triangle. Okay, now look, first posterior triangle. So what is posterior triangle? It is the space on the side of neck situated behind the sternocleidomastoid muscle. Now what are the boundaries? We have discussed. Anteriorly we have the, see, this is the posterior triangle. Anteriorly we have the sternocleidomastoid. Posteriorly we have the trapezius. Inferiorly, or the base, we have the clavicle, and apex is the meeting point of these two muscles. Okay, next, roof. What is the roof? How the roof is formed? Obviously any roof is formed by the skin superficial fascia, and the superficial fascia contains some muscles and nerves. So that one muscle is platysma. And what are the other nerves which are present in this roof? So if I draw all these nerves in this diagram, it will be easy for you guys for the contents also. You can easily remember the contents by remembering the roof of the posterior triangle. Now I'll draw the roof of the posterior triangle, like it has platysma. I'll draw the other muscles. Okay, I'll draw the other nerves here. So the first nerve emerging from the roof is the lesser occipital nerve. Obviously occipital means it is towards the occiput, like this. So this is the lesser occipital nerve, and we have another nerve, that is the greater auricular nerve. The name suggests greater auricular, the ear auricular. It goes towards the external acoustic meatus, like this. Okay, now we have another nerve called as the transverse cutaneous nerve of neck. It goes like this. And we have another nerves called as the supraclavicular nerves, which emerge like this. Supraclavicular nerves emerge like this. So these are the supraclavicular nerves. I think you guys are clear. I think you guys are getting understand. So this is the lesser occipital nerve. This is the greater auricular nerve, and this is the transverse cutaneous nerve of neck, and these are the supraclavicular nerves. You can easily remember. You like imagine the skull here. You can appreciate here also. So this is the posterior triangle, right? So from here we have to the occiput we have the lesser occipital nerve. To the external acoustic meatus we have greater auricular nerve. Like this we have transverse cutaneous nerve of neck, and like this we have the supraclavicular nerves. Okay, I hope you guys are getting understand. Now this point, the point where all the nerves are meeting, this point, it is known as the nerve point. Okay, it is known as the nerve point. Okay, now I just want to give a small MCQ here. We have a vein called as external jugular vein. Okay, external jugular vein we have like this. Okay, so now what can I tell here? What can I say here is this greater auricular nerve and external jugular vein, they travel parallelly. Okay, so this is the external jugular vein. This external jugular vein and the greater auricular nerve, they travel parallelly. So this is one of the MCQ. It is important for surgical point of view. Okay, so this is the roof. I hope you guys are clear with the roof. We have nerves. You remember the roof, you can easily write the contents of the posterior triangle also. Now what is the floor? So there are some muscles forming the floor of this posterior triangle. So the muscles are, these are covered with prevertebral fascia. It is an important MCQ, with which fascia all these muscles are covered. It is with the prevertebral fascia. and from above downwards the floor is the splenius capitis, the levator scapulae, the scalenus medius, and semispinalis capitis. We can appreciate this in this diagram. It is the from the, what do we say, from the above downwards we have splenius capitis and we have levator scapulae. We have the scalenus medius and semispinalis capitis. You can appreciate here the splenius capitis, levator scapulae, scalenus medius. Okay, I want you guys to represent the same diagram in the exam for better marks. And we have an MCQ here, the very important MCQ: the trunks of brachial plexus emerge between scalenus anterior and scalenus medius. You can appreciate here, this is the supraclavicular triangle, right? In the supraclavicular triangle you have muscles called as scalenus medius and scalenus anterior. From between these two muscles there is emergence of roots and trunks of brachial plexus. Okay, now let us talk about the contents. So what are the nerves? You can write all the nerves forming the roofs. Okay, and you can also write the muscles of the floor. I hope you guys are clear. Okay, see, we have discussed roof here, no? So this roof is only the contents, okay, of the both the triangles. You can appreciate here what are the nerves present in the occipital triangle: spinal accessory nerve, or the, which we call the spinal accessory nerve, and the four cutaneous branch of cervical plexus. We'll talk about spinal accessory nerve again in the next coming topic. We'll talk about spinal accessory nerve, but remember these four cutaneous nerves: we have lesser occipital, greater auricular, anterior cutaneous or the transverse cutaneous, we have the supraclavicular. Okay, and you can write the vessels: occipital artery, as we have occiput here, we have occiput, no, base, this is the occiput, we have occipital artery, and we have some lymph nodes also. And the subclavian triangle, we have discussed that the roots and trunks of brachial plexus emerge in the supraclavicular or the subclavian triangle between the scalenus medius and the scalenus anterior muscle, right? So these roots and trunks also become the contents of the subclavian triangle. And here in vessels we have the third part of subclavian artery. So this is very much important, you guys need to focus here only. So which part of subclavian artery is present in the subclavian triangle? It is the third part of the subclavian artery. Okay, and we have the suprascapular artery, and we have the external jugular vein, which we have discussed here, no? External jugular vein, and we also have lower part of external jugular vein. You can appreciate all these things in this diagram. You can see, you can draw this diagram also. This is the posterior triangle. It is divided into two parts with the help of inferior belly of omohyoid. So what are the contents present in this the upper one, the occipital triangle? So one is the occipital artery, the next the four cutaneous nerves, along with it we have spinal accessory nerve, and we also have the supraclavicular nerves along with the lymph nodes. Okay, once again I'll repeat, we have the occipital artery, we have lymph nodes, we have the four cutaneous nerves, and we also have the spinal accessory nerve. Now if the spinal accessory nerve, if it gets paralyzed, the trapezius muscle, sorry, the sternocleidomastoid muscle also gets paralyzed. Okay, so the sternocleidomastoid muscle also get paralyzed. I'm sorry guys, just remember, if there is paralysis of this sternocleidomastoid, there will be injury to the spinal accessory nerve. Now what are the contents of this, the subclavian or the supraclavicular triangle is? So the first is the trunks, roots and trunks of brachial plexus emerging between the scalenus anterior and scalenus medius muscles. We have the subclavian artery, which part? The third part we have in the subclavian vein. So this is all about the contents, and you can draw this diagram or you can also draw this diagram, it's your choice. So this is all about the posterior triangle. If you have any doubts, please do comment in the comment section, and don't forget to follow us on Instagram and Telegram channels. The links are in the description, and if you have any doubts, please do text us or DM us directly on Instagram. We'll definitely reply you guys. And thank you for watching this video. Once again, thank you so much. Have a nice day.